to approve our agenda, please?
I'll motion to approve the agenda.
Okay. Motion by Holmes. And as soon as he gets unmuted, I think we'll get the second from Armstrong. Can I get a second from you?
I'll second it.
Okay, very good. We have a motion and a second. All in favor say aye.
Aye.
Okay, if we could stand and pledge allegiance, please.
One nation, under God, indivisible, with liberty and justice for all.
Oh, that's even better than acapella. All right. So on our agenda today is we'd asked Jess to bring us a report about any efforts that the county needs to take or make in regard to the wearing of masks, social distancing, the Friday evening change in statewide policy by the governor. Jess, if you'd unmute and give us your recommendations, we'd appreciate it.
Yep. Can you guys hear me okay?
Yes.
Yes.
Okay. I would like to see a countywide mandate issued. I did talk with the executive director with Iowa Public Health Association, and she said that the supervisors can issue that mandate if they would like to do so. I know, in talking with some businesses and stuff, they would like to have some support from the county showing that, that they can enforce that within their buildings, within their businesses. If you guys don't want to do a countywide mandate, I would say at a minimum, I would like to see at least a mandate within the county buildings. I can say for here in the annex, we definitely want a countywide mandate. We have a lot of people in and out of here and a lot of people who are that elderly population, and I think it's very important to keep everybody safe, and just like the social distancing, that is a big key in helping slow the spread. And we've done a great job. We've gotten our numbers down here in the county and in the state, and to me, I think it's a little crazy to go backwards is what it seems like we're doing here, is we're going backwards.
Any comments, Alan, Jacob?
The last thing the Board of Health recommended wasn't doing a countywide mandate, if I remember correctly.
So the reason they chose not to do that was because the governor issued her mandate the same day that we were going to do ours.
Would we not have to have a proclamation, a public hearing and public meetings to do some kind of a mandate if we even can do that?
Yeah, you guys would want to have something on record.
Well, currently the numbers in Page County as of yesterday, 28 active cases over 14 days combined, meaning out of 15,250 people, we have 99.98% or 0.8% that are not currently testing positive over 14 days. So I myself don't agree with any kind of a countywide mandate.
We've also seen a massive decrease in testing. We're testing maybe 5 people a day, and you can see that our countywide positivity rating is a little higher, and that is because people just aren't testing. But those people who are testing are coming out positive.
Yeah, one of the things I'm seeing over here, and I would agree with that comment that Jess made. We're hearing of businesses that maybe people aren't getting tested. They just are sent home sometimes without knowing if they for sure have got COVID or not. I know when I've had issues twice in the restaurant, I've made my employees go get tested because I wanted to make sure we knew one way or the other so we could protect our customers. So therefore, numbers are numbers, and you can spit them out any way you want to, but if people aren't going to get tested and they are positive and going home, That really can skew everything. So
You're recommending a mandate countywide, which, what does that look like? I mean, are we talking law enforcement? Are we talking, I mean, how do you enforce a mandate, I guess, is the first question that would come to mind. I know people in public health, I'll just back up and say, I know people in public health are working, like you, Jess, are working with this issue 24/7, and you're on the front line and have probably the best, or should have the best feel of any of us about what we need to do. I respect that, but I just wonder, when you do a mandate, what does that look like? I mean, and we know that there are people right now in our buildings that don't honor the mask mandate. We have people walking in. Thank goodness most people are respectful of that request, but the mandate, what would that look like?
Well, I mean, you guys can really make the decision on how you want to handle that. I can get you some specific mandates that are in place now, so you can kind of review to see what other counties and cities are doing. I wouldn't really recommend doing a, you're not going to want to fine people or do anything that drastic, I wouldn't think. It would be more educational, more showing that we support that we support the mandate, that we really want people to wear their masks when they're in public, when they're around other people. To me, I look at it more of a respect thing, because it's just respecting those people around you.
I've had, Jess, you brought up businesses talking to you. I've had a bunch of businesses and individuals email and call me and talk to me, not wanting the government or county government to step in and make a mandate. I mean, and south of us down in Nottoway County, the city of Maryville did a mask mandate, and it has been quite a thing. In Nottoway County as a whole, their commissioners did not go along with it and still have not, even after being asked to. You're entering into a giant amount of paperwork and rules and definitions for people who can't wear a mask, and trying to create something that cannot be enforced.
Well, there would be exemptions in there, obviously, for those people who can't. I would like to know why people are so adamantly against wearing masks.
People have choices. Everyone gets to decide how they mitigate their risk. There's lots of issues where are you going to stop this? Hand washing's pretty effective too. Who's going to mandate that that's done?
Yeah, I agree with that. But it's not, I guess I have to look at it through the eyes of public health. It's not just a matter of mitigating their own risk, it's those around them.
So,
Yep.
can I talk a bit?
Yeah, please.
I guess I feel some responsibility here because I brought this topic up during my engineer's update on Tuesday to certain, to have a discussion at the very least. We know the governor lifted the mask, or she had a health proclamation the previous Friday that removed the mask mandate. So, I looked at the other mask mandates, and they clearly had mask mandates, in big font. So it's not in the current one. So I want to be able to keep my guys, in compliance with the rules. So I would like to, following the governor's lead here, I would like to remove mask wearing requirements in at least the secondary road buildings. In general, we don't work right beside one another. The majority of our work is done, in individuals. I don't like a mask. It fogs up my glasses. It makes people hard to recognize. People know the engineer and I don't know them. That's, you know, that's not the way I like to operate. Now, certainly if somebody in the, a road worker wants to wear a mask, he can certainly wear a mask. We're not gonna tell somebody they can't, but I don't want to require masks. I'd also like to go back, you know, we're letting people attend athletic events, so there's more than a dozen people together, you know, close sporting events are going on. I like to go back to return to normal operations in that matter, and maybe I shouldn't call it normal operations, but operations the way we previously did. For example, during the winter when we're not pushing snow, we would assemble people from the outlying sheds would come into the main shop and be arranged in crews and sent out. You know, we have crew cab pickups. We're cutting brush somewhere. We'd put 4 people in a pickup, in a crew cab pickup. Or if we had extended cab, 3 cab, and Jeff Sherlock, my maintenance superintendent, can add some more details on how our separation is perhaps hampering the efficiency of our winter operations, you know, at least right now. Another thing, we don't have enough pickups to put 1 man in a pickup. So we put 2 in and we wear a mask right now. But so far, we've had a few cases of positive COVID and we've handled those. Are we any more than 3, Lisa? We still have a count of 3?
He's holding up 3 fingers.
Okay. Is Jeff available to speak about how this is affecting operations a little bit?
Jess, are unmute.
Yeah, can you hear me?
Yes, sir.
Oh, it's just productivity. I mean, we're just kind of in limbo on everything. It seems like, I mean, the weather's not helping at all, but as far as, you know, trying to keep guys out in the machine, out of the outer sheds, you know, we're starting equipment every day and putting extra hours on equipment, and it's just things like that it's just not very efficient as far as that goes. As far as being around each other, you know, in the mornings when we come in, pretty much everybody just stays apart. I mean, we kind of maintain the 6-foot distance for the most part, and of an evening when we come in, but we've been just trying to stick 2 guys in pickups and this and that and getting by. But as far as the outer sheds, we're not bringing those guys into the shop. The reason we did that was to kind of, in case we had a big snowstorm and we had an outbreak of COVID, we would have a crew that could push snow. But it's getting to the point where it's not very efficient.
Can I say something real quick?
Yes.
So I guess the way I look at a mask mandate is if you can't keep that 6-foot distancing, that's when you really need to wear that mask. To me, it makes it more efficient because if people aren't wearing masks and you're exposed to somebody, you're going in quarantine. You can't work. Whereas if both parties are wearing a mask, the exposed person can continue to work. So I guess I look at it as it's actually helping things as opposed to putting people in quarantine who are then exposed to a positive case.
Any other, we have 3 electeds in our room. Does any of the electeds have any comments about where we're at and where we should go? If so, please come to the mic. I'm sorry, they need to hear you on the other end, Brenda.
I can echo a lot of Jamie's comments. I would want to ask at the top of my head anymore, but I would like to go back to 11 on.
We can't hear Brenda.
I would like to go back to have it recommended to wear masks so we don't have to constantly police this when they come in. And a lot of ours, when they're coming in, you can't see who they are when you're trying to give them a birth certificate to make sure they're entitled. So you have to tell them to pull down their mask to get the birth certificate. You can't tell. We have been doing the same thing. We have plexiglass. Everybody has been honoring that. We do have several researchers now that's coming in. Are going to be here for quite a while, and he's been wearing his mask. So I guess I would just like to change the verbiage on the doors to say recommended.
Can you give us some more definition? You commented that you don't like policing it. Can you give us an example of how you've had to police mask?
Well, when they come in, if they don't have a mask, then they come to the counter and they say, do you have a mask for us? Because we don't have one. So we do have a few that we have used. Otherwise, they're using a hat, they're using whatever they have to put up against their face. So, I mean, I don't know.
But you haven't had cases, when you said you were policing it, where you've told people to walk away if they didn't have a mask, or you haven't had instances
We
where.
haven't yet, because we've had some masks that we could provide for them. But when that forces out, then here we go. We're going to be policing it. You know, we had on Tuesday, we had like 6 researchers back in the vault. They all have their mask on, but they can't do the distancing. But, you know, I think that we just kind of need to be consistent of what we're going to do here. And then we'll follow through.
So I guess I would be concerned that you would allow 6 people in close proximity.
We're going to have to change that. If we decide that we're not going to do the mask and that they don't have it, then they're only going to get one person back there at a time. I mean, some people don't have masks when they come in.
Okay, thank you. Angie or Melissa, any comments?
I'll echo what Brenda said, and I would like the verbiage to change to recommended, not required. I think that she said they police, we don't police, because you know the individuals that are not going to do it anyway, and especially now with the governor's change in her proclamation, we see that even more. So we say something and then we don't make them leave. So in reality, I think no matter what we do, we're still going to have the same issues. So if we just change it to recommended, it helps. We have plexiglass, we're safe. We wear our masks out in the public spaces as employees. So I think it's time to be responsible for ourselves.
Okay. Excuse me. Thank you. Melissa, do you have any comments? Okay. So Jesse, something I was curious is follow-up. You know, back when Board of Public Health was going to ask us to do a mask mandate, and then the governor did her limits, you'd made comments that there are other counties and municipalities where the boards have issued mask mandates. Do you have any data on that, numbers or locations?
Ames, Cedar Falls, Cedar Rapids, Decorah, Des Moines, Dubuque, Harrison County, Iowa City, Mount Vernon, Muscatine, Waterloo, and Waukee are the ones that I have on my list right here in front of me.
Okay. Do you know, were those all, excuse me, were those all mandated prior to the governor's November health proclamation, or have those occurred since this past Friday, any of those?
These were all before. I don't know if anybody has done any after.
Okay, thank you. Well, it's a sticky wicket. I think we can all agree with that. You know, I'm glad that our numbers are starting to decelerate. I read an article this morning. I read several newspapers every morning. It happened, I think this one was out of the New York Times, talking about the trajectory of positive cases being down, hospitalizations being down, and the deaths, most importantly, being down with the number of vaccines that have been shot in arms to this point. However, to Jess's point, I know people will argue this, but I believe, based on what I've read, that wearing the mask, social distancing, has indeed had a positive impact on these numbers. And I know people will argue that, but the only concern, I mean, I think we're trending the right way, and I think people are not getting tested, which has an impact on the lower numbers. May not be as accurate now because of the number of tests being reduced, but I think we're on the right track. The only concern that I really have, based on daily reading of Kansas City Star, St. Louis Post-Dispatch, the LA Times and New York Times, are these variants that we're seeing across the country that we don't really know what protection we have with the vaccines, et cetera. So, you know, I'm not a health expert, don't pretend to be. And I think that people do have a personal responsibility, but I do also believe that the masks are not for personal protection totally. I believe that they're for the protection of your neighbors who may be impacted if you are one of those who is infected with no symptoms. And anyway, I'm just kind of rambling now. I don't know what the right answer is. I think that I have the utmost respect for Jess, for you, for our public health workers. You guys have truly been on the front line for a long, long time. The fact that you're here is testament, that you're still here is testament to your commitment to following through, because I'm telling you, knowing the stories that I've heard over the last year from public health and the interactions with the public, a lot of people wouldn't be here. You'd go do something that's a whole lot less stressful. But I do struggle with, you know, a mandate because it's just, I don't think it, I don't know. What do you think, Alan and Jacob? I'm just gonna...
here in downtown Shenandoah, what I see, you know, you can't count the stores, the retail, the big retail, because they've been a little stricter on it. But in the downtown merchants, we've got about 20% that even during the recommendation by Governor Reynolds, they didn't wear masks themselves. They didn't care one way or the other if you did when you came in. And what I noticed was some of the people that were very pro-mask, they were a little bit biased about going there and shopping. So it may have affected those businesses a tiny bit. But what I guess my point is, whether we make a mandate or whether the governor makes a mandate, the people that don't want to follow it aren't going to do that no matter what. When it's their own private business, they're probably going to buck the rule when there are no ways to punish or penalize them. My personal thought is, and I'm doing it here at the restaurant, and I would prefer that we make it a strong recommendation that all county facilities are wearing masks whenever the 6 foot is not in place, when they're in public, going back to somewhat the guidance that we had many months ago, and also to recommend everyone in Page County to wear a mask when they're out in public. I believe the grocery stores are going to stay that way here in Shenandoah, and I believe Walmart is going to be recommending, no longer having somebody monitoring it so much, but they're going to be recommending it. That's what it appears from what I've had conversations with here in town. I have several businesses that are very strong that want a mandate. They're very positive about it, and then there are others that don't. So it can go both ways. That's why I guess I'd like to recommend as a supervisor that we ask people to continue doing the hand washing, continue doing the sanitizing, continuing to take care of things. What we're going to see probably in the restaurant world is a lot more involvement by the Department of Inspections and Appeals, and they're going to be really, I think, cracking down on a lot of those that have unmasked and are allowing people to touch things over and over again, like salt and pepper shakers and whatever. I believe that will change. That's how they're going to, the governor's going to probably allow them to be more critical in the restaurant world. The rest of the businesses are going to be kind of on their own. So
Does a recommendation like that make it difficult for the secondary roads and some of these things are inefficient to do what they need to do? Because by recommending it, you're basically saying if you don't do it, you're going against recommendations.
What I'm saying, Jacob, is if they're 6 feet apart, just like they were before, it'd be nice if they have a mask in their pocket or a mask if they need to get up close to somebody. But the few times that I've been down at the shop, none of those guys are within 6 feet of each other.
Right.
So I don't see.
JD brought up some issues. I was just trying to make sure if we address.
Yeah, I'm just recommending for safety's sake, people should mask up if they're going to be within 6 feet. Just back to the basic common sense of this whole thing.
Yeah, the 15-minute guideline. Do you agree with that? Like the way it was?
I really find that one hard because I never keep a timer going of how long I'm around customers. So that's really a tough one in my field because I bounce around a lot. I'm not an office person, so I have a hard one with that.
Yeah, I struggle with the 15 minutes, but the 6 feet is pretty easy. Everybody can be aware of that. The time is, you get engaged in a conversation and you may have an intent to talk for a minute and 20 minutes later you're still talking.
Well, after a year, basically almost, of this mask and social distancing on, do we not think that the entire public is very educated?
We would hope.
Whether what they think needs done.
We would hope, but I'm guessing no. I see people. I went into a restaurant last night, and with the release of the mask mandate, they had stuff back out on the table. They had no masks. They had no gloves. Just complete opposite of what I would have expected in a public restaurant. So. Well,
and I mean, they might not come to the same conclusion as you, but they've made their minds up.
Yeah. Well.
I don't think recommendations are gonna change anything. I think people, like you said, some businesses are wanting a lockdown mandate type situation. Some say, let us have our freedom. I think there shouldn't be any sign on the door. I think I have full faith in Page County residents to do the right thing. And that right thing is what they determine for themselves and how they mitigate risk. We have enough plexiglass in stores and businesses in the courthouse to protect people who want to be protected, to mitigate risk that way. So I believe we should just go back to the way it's always been and let people mitigate risk how they feel necessary.
I think that people need to take personal responsibility. I agree with that. The only part of your statement I struggle with a little bit is, again, the asymptomatic history of COVID and people who have this and they're living with it, they don't know it. If I'm one of those people and I'm not wearing a mask and I'm in contact, I do put my neighbor at risk. And, you know, it goes back to, in my mind, the Declaration of Independence. The pursuit of life, liberty, and happiness ends at a door that impedes the life, liberty, or happiness pursuit of my neighbor. And since we could have this and not know that we have it and not really be negatively impacted, and we are not mitigating for others, I think that's the part that is different to me in this.
You enter into that, though. Why do we not have somebody wiping the door handles of the courthouse every time somebody goes in and out? They touch that door handle. I mean, you can stop and start that anywhere. And I don't know the asymptomatic, going like you, I'm not a doctor in any way, but I thought that had been that's not as big a fear as they originally thought. Asymptomatic spread. That's what
I'd question that. I've got an employee that would really question that. She caused us to be closed for almost 2 weeks just because she was around an asymptomatic person that tested positive, and then she was deathly sick. So I know, Jacob, there's a lot of ifs, ands, or buts on everything, but
But unless we're willing to wipe down door handles and go back to just total,
That's why we keep the sanitizer out there so people can use that as they come in, because it would be virtually impossible everywhere in the state,
Right.
in the county, to do door handles for everything. So
right, just you enter into the great unknown of trying to
sure,
mitigate all risk.
sure.
Well, we're never gonna, as we all know, mitigate all risk. We live in a risky world, and it's probably not our role to mitigate all risk.
No.
So, do we have a recommendation? I am sensitive to, Jess's request about the annex, because, and Tom's on the call now, and he offices in the annex. Well, I see Jess is there too. The number of people that during a clinic that come in there is pretty large. There's no way to manage efficiently 6 foot. And we have people coming to get vaccinated. And right now, the 65 plus crowd, which is still considered, I think, by most medical professionals as the more at risk crowd demographically, I would understand requiring a mask when you come in for a clinic. But I don't know how you guys feel.
I wouldn't be afraid of that. I think the hospitals are still requiring masks. And to me, this is almost kind of a hospital setting when you've got a couple of nurses giving out shots. I think this would be a prime example of where it would be a very nice requirement.
Your thoughts, Jacob?
There's, again, the required, you'd have to define it pretty well, because there is some people who can't. And I just, it's not enforceable. Are you gonna refuse somebody to come in?
I think they would. I
Well,
definitely, I
then
think
how,
The
If you-
hospital does.
if they can't, let's say they can't, and you refuse them, then what have you opened yourself up to? There's all kinds of handicap and disability things. I don't know. You have to have a large amount of definitions if you want to make something real stiff. I don't know. I see what you're saying about being a specific building. Is that not, does the Board of Health over that building? I guess we own the building, have some kind of control, but
we own the building.
so.
And I think it's very simple. I don't think you need to complicate with a bunch of rules. You just, if somebody comes in, they don't have a mask, say, sorry, you gotta have a mask. Then they have the discussion, say, look, I can't wear a mask for this medical reason. Our people are reasonable. They would be able to filter out whether that was a reasonable rejection. I mean, to me, you can write
When
100
would this,
something.
when would something like this end?
Well, hopefully when we get more vaccines in arms. And right now, what is the number in Page County? How many people have had 2 doses in Page County? Do you have that number, Jess? She's on another call, I think.
Just a second to find it.
Okay.
Vaccine series completion has been 649, and we have done 2.1 thousand total. I mean 2,100. Sorry.
2,100 have had at least one. 649 have been complete. Is that correct?
I'm sorry, Chuck. What was that?
Okay, so the 649 number in Page County, those are people who have had both doses of the Moderna?
Yes.
Okay. And so that would leave approximately 1,450 that are awaiting their second dose. That would take place sometime in the next 30 days. Okay. And do we have any other update on supplies? I mean, what what have you heard? What's the latest about the number of doses? Because I know you had, at last count, 1,200 people on your waiting list.
Yeah. We have probably 3,000 on our waiting list right now of that 65 plus population, and we are getting 300 doses a week.
300 a week. Okay. So that's 10 weeks with the list if it doesn't grow. And then that doesn't, okay. So to me, there's part of the issue, Jacob, in that I know there are people who aren't frightened by this. There are people who are very frightened by this. And if you send a frightened group of people into a place where people aren't social distance, aren't masked up, it's not fair to do that.
Jess, do we have any idea in Page County? I know schools have been getting them, hospital staff, emergency staff. Do we have any idea total in Page County of Page County residents that have received 1 or 2?
Yeah, 21.
Access to that.
21.
That's everybody. That's not just you. That's everybody. Okay. Okay.
Well,
So
any other?
basically, did all the other department heads basically want to go to recommend? Is that what I gathered?
I understand recommended but not required. And I would be happy to do something like that in the secondary roads. And it makes perfect sense to me that the annex with more public traffic, and I mean, that's where people are going to get their shots. I mean, yes, there should be different guidelines to that place. It makes sense to me.
Any other comments? See,
Well, before, I mean, as far as the max over here.
can you, Tom, excuse me, can you come closer to Jess's microphone? I have a hard time, old people have a hard time hearing you like me.
We have never had an issue over here. We've had people come in without masks. We've asked them to put them on. We've had not one argument whatsoever about it.
Okay.
That to me, I used to be the door monitor there at the courthouse, and it was pretty simple. You put a mask on or you're not in. And if they didn't want to, my option was I would call somebody. So, I mean, for over here, we have to have them on. That's no brainer. The other thing is, you know, we do have an obligation to protect our employees here. You guys might not know it, but the state of Iowa is being investigated right now by OSHA because they don't have the mask mandate up at the state house. So, you know, we got to use a little common sense. I understand that. I'm willing to work with everybody here on it, but say no to everything, I think that's wrong.
So, Tom, if before you leave the microphone, I want to make sure I understood. The state of Iowa is being investigated by OSHA for our standards regarding masks?
For a lack of a mask mandate.
Okay.
I sent you the article on it.
Okay, I thought that's what you said. I just wanted to make sure that I understood it correctly. We have Lisa from Secondary Roads. Did you have any comments, Lisa? I know you have a lot of contact with Secondary Roads workers throughout the course of a week. Your thoughts? You maintain that office space there?
We wear the mask here if we're within 6 feet of each other, which, depending on what's going on in the office, is whether that happens or not. But everybody that comes in the front door is respectful of the mask. I don't hear too many grumblings from the shop. We do supply them with masks if they don't have their own. So I'm just listening in for the most part today to see what you're going to do, to know what we need to do here at the office.
Okay, thank you. All right, if there's any other discussion? Now's a great time. Otherwise, we'd entertain a motion on what direction we go with the request on mask.
So basically, the annex can leave or do the sign, whatever sign they want, right? I mean, if we allow them to.
Yeah, if we would allow them
We'll do
to.
a two-part situation here. The annex, then all the other rest of the buildings.
The motion can be anything you want to make it at this point.
The annex is different than anything else. I agree on that.
Okay, would you or Alan like to make a motion?
I'll make a motion that we request masks to be worn in all county facilities in the public health building or the annex. That mask will be required.
I like the word recommend better.
Okay.
than request.
Okay. I'll make a motion that we recommend masks and all other proper sanitary. Well, just make a recommendation that masks be worn in all public or all county facilities when social distancing is not available, and that they be required or recommended to be worn also in public health.
You've already you recommended everything.
Okay. Recommend in the county buildings and require at public health. You don't like the word required?
Can we split them up? I mean, you can make the motion you want to make. I'm just asking that. Can we split the two apart? I'm just asking. They don't have to.
Motion, I guess. You want a second, then we can discuss it.
Oh, yeah. I'll second that, I guess.
Okay, so the motion's been made and seconded. The motion is recommended mask wearing for any county property except for the annex where we are going to require mask upon entrance. And that, I think, did I state your?
I believe yes, that would be correct.
So, I mean, I think if I understand your question, Jacob, can this be done in one motion? I believe it can, if you prefer two motions where it's recommended everywhere and then make a motion. But I think it's clearer if it's rolled up into one.
My issue is with all the other buildings. I don't know that a sign says recommend really matters. The annex is a different situation. So I don't know how I'm going to vote on this according to how it's worded. That's my problem.
Well, I guess, we can call for a vote here, but I would state that out of respect for the request by our public health director, who is on the front line of this every day, and probably, I would hope, and I do believe this, and I don't think I'm wrong, probably has more information consumed than maybe the three of us combined about where we're at as a county. So out of respect to that request, it's kind of a compromise. She came in wanting us to mandate masks. I think this board has made it clear that we're uncomfortable with mandating the mask. I think all of us have reservations about that. But I think that recommending a mask makes a statement that we believe it's important to continue to mitigate until, we get a little farther down the road. And I think the health experts are telling us that we have, we're seeing some great trends right now, but they're telling us that we're seeing these greater trends, I think, because of people masking, social distancing in part. Part of it's the herd immunity, and part of it's the vaccination process. And so I think what I'm hearing from Jessica and public health people are, let's hold the line. And what I heard the most about feedback from the governor on her announcement on Friday was, whoa, this seems really premature. From all the people in the health business, they felt, I think if you get somebody to talk from the Iowa Department of Public Health, get them in on this meeting, they would say, wow, we're we're checking the governor's blood pressure because this seems premature to us. But
Could we add, recommend mask and or social distancing? So that, like even for secondary roads, when they're 6 feet apart, they don't have to wear a mask. It kind of defines it clearer.
well, we can't, I mean, I guess,
Because we're not, we all assume that, but it's never written anywhere, so people don't think that way. You know, we recommend a mask and or social distancing when applied, or however you want to word that.
Or
well,
I could say we recommend masks when social distancing is not possible.
Yeah, maybe something like that.
was that, do you want to make that part of your motion? We have a motion on the floor.
I'll make an amendment. Jess, what do you think? Would that help?
I like that. I mean, that's kind of been the
Yep.
full message this entire time is when you can't social distance is when we want you guys to wear a mask.
And from rereading the OSHA guidelines, that's kind of one of the key critical things they talk about, you know, the barriers, distancing, mask, all of those rolled into one, sanitation. So that would probably be fine to add that amendment in.
So, yeah, can you restate your motion so we can get it?
I make a motion to recommend mask wearing in all county facilities when social distancing is not possible, and would require mask wearing at the annex building during all public health clinics.
Okay.
Only during public
Only during public
health.
health clinics?
Or no, I guess I don't want to say that way. That'd be too complex. Require mask wearing at the public health or at the annex. Keep it simple.
Back just to make sure I have it correct.
Yes, please.
I have recommended in all county buildings where social distancing is not possible, except for the annex where masks will be required.
I believe that's summarizing what you
Yes.
intended, Alan.
Yeah, I believe so. A little hard to hear you, but I think I got it.
Could you hear it, Jacob? You need her to repeat
Yes.
it?
I'm sorry, I think I heard it correctly.
So that's our amended motion, and you still second that, Jacob?
Yeah, I'll second that.
All right, so we have a motion and a second. Any other discussion? All right, let's take a voice vote. Since you're on Zoom, I'm going to do this backwards today. Anyone opposed to that motion signify by saying nay. Hearing none, the motion passes 3-0. Okay, thank you. Okay.
I would suggest, Tom, if you're still listening, you might keep the OSHA stuff coming out to all the department heads in the courthouse too. Never thought about that, but they might be interested in reading what OSHA is going to be looking at and discussing as it comes down. I know that Mark is trying to keep you abreast of all the news from OSHA, but that's going to be something I'm going to guess that we're going to really want to watch close.
Gotcha. All right. Was there anything else? I think that.
Did you get that, Tom?
Yes, I did.
Okay, thank.
The other comment I would have to say is I had started a while back ago putting together a policy similar to what has been discussed here about the mask that I can send you guys to look at.
Okay.
You can tweak accordingly. So, but I think it pretty well addresses everything that was addressed here. That way it's in writing. Everyone understands.
Okay, that'd be great.
Thanks, Tom.
I will ask the auditor's office if we could get the signage changed. Lisa, can you change the signage at your place? Oh, Tom does that. Hey, Tom, are you gonna be able to take care of changing the signage in the buildings for us?
Can you hear me?
Yep.
Yes.
Well, I'm helping out with the clinics for the next few days, so I can sure try, but I'm not going to guarantee anything.
Okay, I'll see that we'll print up the recommendations and I'll get them disseminated to our county.
On the signage at the courthouse and the other buildings, Mass recommended he could include the social distancing little line below it, might
Okay.
clearly, because people don't put those two things together.
Okay. All right, we'll get that done.
We should
Put
have.
'em up on this handy dandy printer here. Huh? Thank you, Tom. Any other business? I don't have the agenda in front of me. I think that's all we had. Okay. So any public comment? All right, hearing none, I would like a motion to adjourn, please.
So moved.
I'll second that.
Okay, motion made and seconded. Anyone against, signify by saying nay. By the way, all three of us got an email from the Omaha Foundation yesterday. I reached out to John for some additional information on that. Did you guys, I assume we all three got it.
I
You get
didn't.
that? You did not?
No, I don't
Did you
think
do
so.
it?
Either.
Okay, I'll send it out to you. It was a request from the Omaha Foundation on sponsorship of a grant, and I'm not quite sure what our role is. So I've asked John for more information, so I'll send you that email so you're in the loop. Okay.
Okay,
All right. Okay. Thank you. You guys have a good
Thanks.
day.
thanks.
Yep.